I'm Dr. Lauren Barron, and I am the director of the Medical Humanities program at Baylor University. And today I feel like talking about a painting. So many of you have seen this painting, 1891 by Sir Luke Fildes, and it hangs at the Tate Gallery if you have a chance to see the original in London. And this is not necessarily an excellent copy of the painting, but it's a painting that hung in the office of Red Covington, who was beloved at Baylor as an orthopedist, served the Baylor Bears and the athletes, and I'm so honored after his passing that his family gave me this painting. So I had the chance to hear a physician in Italy talk about this painting, and I thought it was spectacular. And what he asked the question, what did the humanities do for us? Why do medical humanities matter? What does it mean, and why does it matter, and how does it make an actual difference in our lives? So he asked us to look at this painting, all right? What's going on in this painting? So we can see several things. We see a small person, a child, laying across a bed made out of these two chairs. Notice that the chairs don't match. Notice this is not a bedroom. Notice this is downstairs. We see light in the window. We see the lampshade here tilted. It's difficult to tell whether it's morning or night, but most people who look at this painting based on the things on the floor and the cups and the different items here, kind of the look of exhaustion in what this woman that we presume to be the mother, that this is the morning hours. And here is this person in a suit, fancy clothes, and he doesn't have a stethoscope, right? But you know that I already told you the painting is called The Doctor, so we can presume this is the doctor. Notice that the attention of this man that we can presume to be the father is not on the child, but it's actually looking at the doctor. Another thing you can see is there's some like fishing nets and some things around this humble home, fairly humble home. And what we're drawn to, I think we can all agree, is this space right here, you know, the space between the physician and the patient. This very, very kind of tension-filled, drama-filled space, what's happening here. And Dr. Giorgio Bordin, hello in Parma, if you're here. I'm hoping I can get you to Baylor one day. I tell all my students about your book. I highly recommend this book, Medicine and Art, Giorgio Bordin, and I haven't met the other author, D'Ambrosio, but I highly recommend this book as well. And Dr. Bordin is a photographer, and like I said, I'm hoping I can get you to Baylor one day. But what he talked about is that what he thinks it has to do with is the quality of not just tension, but attention in this space. So the humanities, study of the humanities, whether it's art, whether it's literature, whether it's reading patient stories, whether it's philosophy, or whether it's religious studies, whether it's sociology, whether it's philosophy and bioethics, that paying attention to the individual stories that the humanities are so good at preserving and passing on, the history of medicine, for example, that what this does is it trains our minds to pay special attention to the individual in front of us, not just their pathology, but who they are as people. And that's what he says, is that a study of the humanities alters the quality of this space, the capacity to pay attention. Isn't that something? And what you may not know is that Sir Luke Fildes had a son who died on Christmas Eve of typhoid, and that the image of the physician who was caring for his son left an indelible image in his life, and that is what inspired this picture. So 1891, Sir Luke Fildes, and I just learned something I wanted to pass on, and that is that in 1949, Harry S. Truman used this picture along with the AMA, the American Medical Association, in 1949 in a program called Keep Politics Out of This Picture, okay, to talk about the role that the negative role that government and business would have if they were inserted into this picture. You know, keep politics out of this picture in 1949. And there were 65,000 copies of posters to talk about the danger of the government and big business getting in between doctors and patients. That's why you need to know about medical history. And I hope that you'll see this painting in a new light and think about the way that your immersion and experience with humanities helps you to pay particular and special attention to that human being in front of you.